All right, ready to go.
Alrighty, so today we're going to be presenting brain damage. My name is Torrin Martin.
My name is AJ Oshodi.
My name is Lida Kaler.
And I'm Nina Chestnut. Okay, sorry. So our very first part of this presentation will be about cortex removal and the study and how it impacts specifically pediatric patients. So if you look over on the right part of the screen, you can see an MRI of a person's skull, and we can see that actually half of the brain is missing. And while you might be thinking, wow, this person's probably dead, no, this person's actually alive. This is an MRI image of a young girl. She's about 14, and half of her brain was removed because she had a type of epilepsy that was resistant to drugs, any type of medication she took. And so as a last-ditch effort to stop her epileptic seizures, surgeons removed half of her brain. And while you're thinking, wow, she must have some severe life complications that come with that. She does have to take a lot of extra medication, but she's able to function fairly normally as a normal 14 or 13-year-old girl, even in spite of the fact that she has literally half of a brain missing. So this sort of solution to brain trauma caused by epilepsy has actually become a fairly common procedure now. We have a very interesting case study, which in total of 10 children who all had drug-resistant epilepsy, excuse me, and all of them had half or cortex of their brain removed. And this study found that actually these children were able to function somewhat normally. They all had normal levels on all reading, writing, and comprehension tests, except for 2 children who had almost all of their visual cortex removed. And they couldn't pass this test because they couldn't see. So it's very interesting to see how, as children's brains grow and develop, they're able to compensate for missing parts of their brain, called brain plasticity. And so we can see here a comparison between pediatric brain trauma and adult brain trauma, and how those two compare and contrast. So to understand this, first we have to understand the 2 different kinds of brain trauma. It can be either focal, which is from a gunshot wound or something very sharp penetrating the brain, or diffuse injury, which is shaken baby syndrome or brain bleeds caused by aneurysms. It's very interesting to note that children are very differently impacted by brain trauma than adults are, because signs of symptoms can appear many years after the trauma has actually occurred in a child, versus with the adult, it's pretty immediate. We can see the cognitive difference. But for children, it takes a long time to develop because children's brains are always developing, and the brain is going to work hard to compensate for the missing part of the brain, or for the brain that is no longer functioning because of trauma. And that's why concussions are such a big deal in schools, and why speech language pathologists are such a big part of schools now, because they've adapted this return to learn protocol after children get concussions or get hurt. They have to work hard to ensure that the brain is continuing to build learning into its own growth cycle. And that's why children brain damage is very different than adults.
An important case study involving expanding the knowledge of brain regions is the Phineas Gage incident. This horrific occurrence of the Phineas Gage incident plays a significant part in the study of the damage to the brain, as it was the earliest recorded case of brain damage affecting personality. Gage was involved in an accidental explosion while working on the railroad, which unbelievably propelled an iron rod into his cheek and out through the top of his head. Despite how fatal this incident sounds, Gage survived and remarkably lived to tell the story. However, although majority of Gage's physical functions remained intact, including his communication and motor functions, his personality was severely affected, as many people around him claimed that he changed into a more unreasonable and impulsive person. The result of this popular study incident, along with others, sparked the interest of many scientists studying the topic of brain lateralization and mapping. Although Gage's incident led a new path for neuropsychologists and other scientists, it was found very difficult to establish any clear understandings between brain damage, injuries, and cognitive functioning. This knowledge proved that the mapping of the brain regions remained easily changeable until better technology was created to advance the studies.
Oops, I was on mute. So we broke the technology behind brain injuries into two different categories. First, the ways of treatment, and second, the ways of research. For the ways of treatment, technology is usually used after a blunt force impact, skull penetrating injury, deceleration injury such as whiplash. And then when that happens, patients will receive either an MRI or a CT scan, possibly both. What these technologies do is basically give doctors and technicians a better look at the damaged tissues inside the brain. They're still fairly new technologies as they were created in 1967 and 1977 respectively. And physical, cognitive, and occupational therapy are also used and usually applied more often to severe traumatic brain injury victims. And what that can look like is speech therapy or even physical rehab. And then for the ways of research and technology, technology when it comes to brain injuries has improved vastly in the past 20 years. University and tech foundations are around the globe conducting studies constantly on the topic. They often work separately, but sometimes they come together to join up in their research technology. In these cases, MRIs are also used to show certain damaged tissues and injured parts of the brain, and then they're studied after that. And actually, new technology was researched out of University of Georgia that uses injections to let cells have the best chance at recovery after TBI. So basically, they're always working on new technology for research so we can learn more as we go into the future.
Methods of experimental procedures, a brain lateralization. The split brain procedure was conducted in the 1960s by Roger Sperry and Michael Gazzaniga, conducted some of the best-known studies of brain lateralization. Split brain patients had their corpus callosum severed as a last resort treatment to prevent the spread of epileptic seizures from one hemisphere of the brain to the next. They discovered through experiments that the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. The image below on the left shows a normal brain, and then with the connective tissue, which is the corpus callosum, removed or severed in the right image. And the experimental procedures is shown in that image cartoon below. When showed an object on the left side of their brain or to their eyes, they were able to comprehend what the object was. And when shown an object on the right side of their brain, they were able to comprehend and recall the name of the object. The curious case of patient HM. On September 1, 1953, Henry Malaysian had a thumb-sized section tissue severed from each side of his brain. He was 27 years old and had been having seizures for the past 10 years of his life. They affected his everyday life. So they decided to do this procedure on him. And his seizures did stop, but he could no longer form any new memories, and he had permanent amnesia. This tragedy led to the discovery and understanding that complex functions of the brain, such as learning and memory, are tied to distinct areas of the brain.
All right, and that was our presentation on brain damage. Thank you so much for paying attention.